morning, the most news in the morning, period. Weekdays 6 Eastern.
Good, thank you. Good to see you.
If Washington wants to reform health care with bipartisan support, consider what former Republican presidential candidate Mitt Romney did as governor in Democratic Massachusetts.
You don't have to have a public option. You don't have to have government get in the insurance business to make it work.
3 years after enacting its own version of reform, Massachusetts now has near universal coverage. Taxpayer watchdogs say it's affordable.
There is this widespread assumption that is now treated as fact that it's breaking the bank in Massachusetts.
And is it?
It's not breaking the bank at all. It's not even costing much at all relative to what we were spending 4 years ago.
And healthcare experts say it's popular.
7 in 10 people in the state support the program, and no more than 1 in 10 would repeal it.
Unlike Democratic proposals that would give Americans the choice of joining a government-run healthcare plan, Massachusetts has no public option. Instead, people in the state are mandated to buy private insurance. The poor get subsidies. Analysts say Romney Care is basically Obamacare minus the public option.
If the president drops the public option, will you come out and support him?
Well, it depends on what's in the rest of the bill.
Romney says Democrats only have themselves to blame for those rowdy town hall meetings.
I think any time you're dealing with people's health care and their ability to choose their doctor, their ability to decide what kind of health care plan they want, you're going to find people are going to respond very emotionally.
As for that other former governor's now debunked claim that reform would lead to death panels.
What did you think when you heard Governor Palin talking about death panels?
I hadn't read that into the bill.
You think it's okay for the governor of Alaska to be talking about death panels, pulling the plug on grandma?
I'm not going to tell other people what they can and cannot talk about.
But Romney does warn the president bipartisanship is the only road to health care reform.
I think the right process for the president to pursue on health care, on an issue that is so emotional and so important to all Americans, is to go through the lengthy process of working on a bipartisan basis. He promised that.